Hey guys, welcome back to Black Ambassadors of Change. Don't forget to like, share, subscribe. So this week we're talking COVID-19 and the Delta variant. Stay tuned. Don't forget to like, share, subscribe. Tell your friends, tell your family that Black Ambassadors of Change is on, and we are here to inform, educate, entertain, and inspire you. Don't forget to like, share, and subscribe, guys. Subscribe. See you soon. Black Ambassadors of Change is on. Welcome back to Black Ambassadors of Change. Again, don't forget to like, share, subscribe. Hit the subscribe button, guys, before you even start watching this video. Please hit the subscribe button. So today we're talking COVID-19. I know we're all tired of COVID. I was trying my best not to talk about COVID again, to be honest with you, but I have to. Only because it seems like things are getting bad again. And the fall is coming up and the winter is coming up. And it seems that people still have some pertinent question about COVID and the effects of it and how you get infected and all that good stuff. So today we're gonna try to explain that a little bit more for you, more detailed, more simple, so people can get this. Because what's going on is that I don't think people really understand the gravity of this, how contagious this new strain is. Let me give you an example. When COVID first came out, for every person that got infected, 2 people were infected by that person. Now, for every person that gets infected, up to 8 people are getting infected by this variant. Think about that. This variant is very, very contagious. It's akin to chicken pox, unlike the first strain that was akin to the common cold or the flu. Guys, we have to take this serious. I know the people are saying, well, this is a new drug. I am not going to put something in my body that hasn't been fully tested. Guys, let me break this myth down to you. It is absolutely false. This drug has been more tested than a lot of the drugs that many of the conspiracy theorists are recommending people try. It is the most insane thing that they will tell you to try something that wasn't tested for humans, was tested for animals, but you would trust that more than you would trust something that was tested for human all over the world. There's data from all over the world, from Asia, from Africa, from the Middle East, from Europe. So it's not just an American thing. So why are we constantly stuck in that? There are things, the only reason you may have an adverse reaction to the vaccine is if you're allergic to something in the vaccine. And that goes for any one of us with anything. If you're allergic to something, it could be peanuts, it could be strawberries, it could be bananas, you will have an adverse effect of it. It doesn't mean that bananas and strawberries and these things are bad for you. We need to take charge of our health. We need to hold this thing at bay, because if we do not, guys, we will end up doing this again next year around this time. Do you really want to do this? Do you really want a third summer to go by where you really can't enjoy your summer? Do you really want to continue wearing masks? Talk to any doctor. If you have pre-existing conditions, I had several people tell me, well, I have pre-existing conditions, so I can't take the shot. It is more important for you to take the shot if you have pre-existing conditions. So I know it seems like I'm really emotional about this, but I am. Because I see people that I love at risk from getting sick and dying. Guys, please go out there, take the vaccine, watch this video. It will explain things for you in much more detail, a much simpler fashion. And hopefully at the end of this video, you will feel a lot more comfortable with going and get the vaccine. Because if you do not get vaccinated, you're allowing the virus to mutate again. Guys, please Let's kill this virus once and for all. Okay, take a look at the video and please feel inspired to get vaccinated. Get your family vaccinated. Try to encourage your friends to get vaccinated, because people are dying unnecessarily and we need to put a stop to it. So take a look at the video, guys, and thank you for watching Black Ambassador of Change.
The Delta variant is concerning because it is spread much more easily than prior versions of COVID-19 that we have seen. This means that more people are getting sick. That means more people are getting hospitalized and dying from the infection as well. The Delta variant is concerning because it's more highly transmissible, but the good news is that the COVID-19 vaccine is still highly protective against getting infected or landing up in hospital or dying from the infection. Breakthrough infection is a rare event where someone who is fully vaccinated still ends up getting infected with COVID-19. The good news is that these breakthrough infections generally have been asymptomatic or only led to mild illness, and the vaccine remains highly protective against winding up in hospital or dying from the infection. The mutations that have caused the Delta variant do seem a bit more likely to break through our vaccine immunity as compared to the original types of COVID-19. If you are one of those very rare breakthrough cases we've been hearing about who still gets infected despite being vaccinated, I want to emphasize those cases are getting a lot of headlines, but they're very rare events, and they are not what is driving the current surge in cases that we're seeing. The current surge is really amongst unvaccinated people, predominantly young and middle-aged. If a vaccinated person gets infected with COVID-19, it is possible for them to transmit it to others. Thankfully, the vaccine significantly reduces your risk of getting infected, which then reduces your risk of passing it on. But yes, it is possible, and there's still studies being done to understand exactly how that risk compares with people who are unvaccinated. Knowing that in rare cases a vaccinated person can transmit COVID-19 to someone else is one of the primary reasons behind the recommendation that vaccinated people now continue to wear a mask if they're indoors in areas where we're seeing a lot of virus circulation. Guidance on masking has changed with the Delta variant for a number of reasons. One is that the variant is highly transmissible. It's spread much more easily than prior types of COVID-19 that we have seen. And so a layered strategy for prevention becomes even more important. So using masks along with vaccination will be more protective than using either alone. So with the Delta variant, we are seeing increased number of cases amongst children. The American Academy of Pediatrics has reported a significant increase in COVID-19 cases amongst people under 18 years of age. So children who are eligible to be vaccinated, which is anyone over 12 years of age, should get vaccinated before returning to school in the fall. It is the single most effective measure that we'll have. So the best way we can protect kids who can't be vaccinated themselves is to make sure that everyone around them is vaccinated. So that means anyone over 12 years of age should go out and get their vaccine, especially before return to school in the fall. Other strategies like wearing a mask when you're out in public, excellent hand washing continues to be incredibly important, both for the prevention of COVID-19 and spread of other infections that we're seeing rise in the communities as well these days. As of right now, there are 3 vaccines that are approved for use in the United States. Children over 12 years of age are approved for one of the vaccines, which is the Pfizer vaccine. So as we've seen the older part of our population get vaccinated and derive protection from COVID-19, we are seeing that children and young adults are making up a larger proportion of new cases of COVID-19. This is for a variety of reasons. We don't yet have a vaccine that's approved for children under 12 years of age, so they're still very vulnerable to getting infected. We also know that vaccine uptake amongst young adults has not been as high as we had hoped, and so there's still a large proportion of that population that is still susceptible to getting infected. If you have not yet been vaccinated, we recommend that you get vaccinated. It is the best thing we have to offer for protection at this point in time.